today we are with Lynette. Her second name is really, really hard. I don't want to even try to attempt it. She works with REPSSI, and she's been working with REPSSI for almost 20 years now. How many years?
With REPSSI, 7 years.
7
But
years.
children in the region, yes, 20 years.
Yes, she's one of those people. When you talk about African children, Lynette is the first name that comes into your head. She's very African, and for the longest time I've known her, she loves children. And she's going to talk to us about violence against children in care settings. And she's also going to talk to us about psychosocial support. She's an expert in psychosocial support, especially for African children. Hello, Lynette. Welcome.
Thank you very much, Jennifer. I'm Lynette Mudekunye, which is a Zimbabwean name.
So, Lynette, just tell us a little bit about yourself and about REPSSI.
REPSSI is a regional psychosocial support initiative. Our vision is that all girls, boys, and youth have psychosocial and mental well-being. We work in 13 countries of East and Southern Africa, which is from South Africa as far north as Uganda and Kenya. We work in both Anglophone and Lusophone countries, and we have a lot of our materials are available in Portuguese as well as in Kiswahili. Our main focus is developing resources and materials and capacity support in psychosocial support. And we are known for things like the Journey of Life process, the certificate program that we have. And we do a lot of work with governments, with civil society around the region.
So we have been talking about violence against children in the care settings. I want you from a psychosocial perspective. I want you to talk about violence against children generally, and then you tell us more about in the care settings and what are the psychosocial issues that come up with that generally and also in the care settings.
Violence against children is just way too common and way too accepted. Many of us think, well, because I was beaten as a child and that's how I was disciplined, therefore it is the way in which children should be disciplined. But what I want to put to you is when violence happens to children, it's very often from somebody they should trust, the person who is supposed to be closest to them. It's almost always someone in the family, a neighbor, a teacher at school, another child at school who is bullying them, the person I love who inflicts sexual violence on me. And the question I want to ask is, what do we teach children about trust when the person you should trust is the one who is inflicting, whether it is emotional, physical, or sexual abuse on you? What kind of relationships are we teaching children to build? And I think this is particularly important in care settings. One, because children in a care setting are already without family care. So they need more love, care, and protection, which is psychosocial support. They need that to be able to have confidence, to believe in themselves, to be able to build relationships with others. And yet, maybe because of the stresses of a care situation, so many children that you are looking after, poor support for the caregivers, inadequate training and understanding of their role, you often find that there is more violence within that care setting. And so a child who has experienced being abandoned or death or bereavement is now also experiencing violence from the people who are supposed to be caring for them, or from the older children within that same setting who are now abusing them and bullying them. And it is so important that we address this and that we make places of care places of care. Care means to love, to protect, to look after. It does not mean to violate a child's rights.
So, and as REPSSI, I know you work a lot in strengthening capacity of governments, CSOs, and communities in psychosocial support. What kind of support do you give as the social workers that work in care settings?
REPSSI has developed a certificate level program. We call it the Certificate in Community-Based Work with Children and Youth. It's offered by distance, and it's offered in 10 countries of East and Southern Africa. This program happens over 18 months, and people who are on the course come together 4 times for each module, and there's 6 modules altogether, and discuss what they are learning, discuss how this is relevant in what they are doing. And we believe that this course is an excellent program for people who are working in care settings to actually begin to think about children, think about children's rights, children's participation, understanding how they can talk, encouraging them to talk, understanding that beating a child is not the right way to love them and care for them. We also have shorter programs and other ways of promoting children's rights.
And we are aware you're having a conference coming up in September.
Yes, we have a
tell us a little
conference
bit?
in Arusha from the 4th to the 6th of September, and actually from the 1st to the 3rd is the Children's Pre-Forum. We are very, very excited about this. We have a number of co-hosts, the government of Tanzania, the East Africa community, and the Southern African Development Community, SADC. We are expecting government representatives from the different partner states of the EAC and SADC, researchers, civil society, people, children, youth, to all come together. And we're looking forward to about 400 to 500 people being there, sharing experiences, sharing what we know, and all developing a movement for caring, loving, and protecting children in our region.
This year's theme of the conference is very interesting: equity,
Equality.
equality for boys and girls, right?
Girls, boys, and youth.
And you.
Yes.
So as someone who wants to just talk to someone who wants to attend the conference and they're interested, what will improve? What knowledge are they going to increase, or what are they going to learn from the conference, knowing that you have already seen some of the papers that are going to be presented during the conference?
You will come and learn about a range of issues which will help you to question whether your programs really are addressing equity and equality, help you to think in terms of the different aspects of equity and equality. It may be for boys and for girls, it may be for children with disabilities, it may be for children living with HIV. We will be looking at it for younger children, for older children, adolescents. We will be looking at quality improvement. We will be looking at the social service workforce that makes sure that children do access equitable and quality services.
Okay, thank you very much. If we are in Kenya, for this we are doing with every person we are interviewing. Can you elections are coming up in the next 46 days. Can you just speak to people who work with children? What are some of those things that as Kenyans should take care of to ensure that children are safe during the elections?
Know where the children are at that time. Look after them, but also help them to understand what is happening in the elections, understand what are the issues. These children will be voting themselves, maybe not this election, but maybe in the next election. It's important that they are aware of why people are campaigning on different platforms, and that they can also begin to think about which platform addresses their concerns.
Okay, thank you so much, Lynette. We look forward to seeing you in September in Arusha. Thank you for speaking to us. Thank you.
Thank you so much.